Hello, my name is Chadi Alraies. I am from the University of Minnesota, and with me is Dr. Bill O'Neill from Henry Ford. Welcome, Dr. O'Neill.
Thank you very much. Nice to see you.
Thank you. Today is the first day of SCAI 2016, and would like to take this opportunity, Dr. O'Neill, to help us fellows in interventional year how to handle the training in structural cardiology and the phase after graduation, going to job and finding the right spot.
Well, I think first, congratulations. You're entering a wonderful field. I've been in it for 30 years, and it's been a time of my life. I was so fortunate. You guys are going to be doing a wonderful thing. You're going to be curing a lot of people, saving a lot of lives. So it's a wonderful field. I couldn't be more excited for you. I wish I would be starting, because what I started when doing this, we had very little to offer. We had these little balloons that were horrible and hard to use, and now you guys can do stuff that I wouldn't have dreamed of. So, I mean, I think the sky's the limit, and the technology and the stuff we can treat is going to be wonderful. I think it is a good idea to get into structural intervention, because as the population ages, there'll be a lot more people with valvular heart disease that we need to treat. And you can see the exciting results from the ACC on the TAVR intermediate risk. It's the first time that cardiology has actually beat surgery in outcomes. So I think that in 5 years, most people, most elderly patients are going to have TAVR rather than aortic valve replacement surgery. Right around the road, mitral valve replacement, left atrial appendage Watchman, and then tricuspid valve. So there's going to be lots and lots of intervention. The question you ask is, okay, do I go out into do cardiology for a while, then go back and train? And we've trained people that approach. If you want to go back for a year, that's great. And if you need to make money now, it's a good idea. So go out, get a job, get experience, and then my suggestion probably would be, from the trainees that I've seen in the last 4 years, the guys that seem to benefit the most are people that have already been out in practice for a while. They've already got some experience. They know how to do coronary intervention. They're very skilled at it. And then on top of that, you're going to want to go and train. It's unlikely that you're going to go out and just do 100% TAVR. Right? It's just not. It's more likely that you're probably going to do some TAVR and some coronary intervention and maybe some peripheral intervention. So that's kind of what I would say is, and there will be, fortunately, there are more and more programs that are now establishing TAVR training or structural heart training, so that's going to be very good. We have a program, and there's probably, I guess, 10 or 15 in the country right now, so there'll be more available.
Right. And how do you advise the fellows keep up with their learning, come to these meetings or textbooks and literature, coming every day, heavy literature on all this stuff? At the same time, we have to be scrubbing cases, doing cases. So how do you find this balance between these two? Be a good physician taking care of the patients and delivering the best care.
Well, I think you can combine the two. Okay, what I'd say is have curiosity about your own patients, and if you have a patient and with whom you're having a difficult management problem, go and look at the literature. What does the literature say? And you can keep current by really taking good care of your patients. I think that's really you did that in training, you keep on doing that during your career. And then I think also it's very good to be around people. So if there's a local interventional club in your community, or the local ACC, the state ACC, just be around people that are doing interesting academic scientific work. It'll keep you bright, it'll keep you interested, it'll keep you engaged. SCAI, TCT, ACC, those are the 3 meetings. You have to pick one of those or 2 and go to those, and they really help kind of get you a thorough update. Mm-hmm. I think it's impossible to stay with all literature. There's just too many articles and too many places. It's just really, really, really tough, you know.
Yeah. Especially nowadays, it's CTO, techniques, physiology, and then you add it with structural. It's a whole new beast. Right. At the end, I would like to thank you, Dr. O'Neill, for your time. Appreciate your time and advice. And please follow us on Twitter account and the hashtag SCAI 2016 for most updates. Thanks, Dr. O'Neill.
Good luck to all of you.
Thank you.